How do you know if you have ADHD? This video isn't a diagnosis, but it will give you clarity, direction, and a very real checklist to consider whether you do have ADHD. What is that 1 a.m. superpower mode where you can just get everything done all of a sudden, but during the day you procrastinate? It usually happens because ADHD brains don't run best based on importance. They run best on stimulation and urgency. So what feels like motivation isn't actually motivation. It's pressure creating adrenaline, and temporarily it switches your brain into go mode. There are 3 main patterns of ADHD productivity modes. You guessed it, the first one is time mode. You see, ADHD runs best on stimulation and urgency. So what feels like motivation isn't actually motivation. It's pressure creating adrenaline. And adrenaline temporarily switches off the brain and puts you into go mode. That pattern often stands for 3 ADHD productivity modes. The first one, time pressure mode. You only activate when there's a deadline or consequences. Number 2, hyper-focus mode. You lock in so intensely that everything disappears, but only on certain things. And number 3, crash. After the burst of productivity, you burn out and feel useless, foggy, or numb. If you live in that cycle, you're not broken. You're likely struggling with ADHD regulation. So how does ADHD show up in real life? If you relate to these, then pay attention. Your long-term goals change every month. 1 month you want a new career. Next month you've started a business. Next month that business isn't going to work, so you've started another business. Then suddenly you want to quit and move somewhere else, maybe even countries for that matter. And you're sitting there thinking, what are these long-term goals? In fact, what are long-term goals? Because your brain lives in the now or not now. Number 2, your email box is chaos. There are tens of thousands of emails, not sorted in any sort of organized way, but it's organized in a way that you feel is organized. Number 3, you're either doing nothing or you're doing everything. Doing 15 tasks at once and at superhuman speed. There's no steady or normal pace. It's all or nothing. I'll deal with it later. Means it's gone forever. If you say you'll do it later, you're not going to. Not because you don't care, because your ADHD brain struggles with working memory or task tracking. If it's not in front of you, it basically stops existing. Number 5, you can't finish anything without checking your phone. Even a 5-minute task turns into start, stop, check your phone, start, stop, start again, check your phone again. Maybe there's another app that could be interesting. Let's check out this topic on ChatGPT. I wonder what this will do. That's an attention regulation issue. Everything is disorganized, but it makes sense to you. So you tell yourself, it's organized to me. But deep down, you know, you're always searching, you're always thinking, you're always in a rush. You're always losing things. You're always late. You always have a reason. But the truth is, you don't prepare and leave enough time like other people do because your brain misjudges time. And that's called time blindness. Super common with ADHD. But everyone does that sometimes, right? Now here's where people get stuck. Someone will say, oh yeah, but everyone procrastinates. Everyone forgets stuff. There's no such thing as ADHD. You're just lazy. But here's the difference. ADHD isn't about doing these things occasionally. It's about doing them consistently across your life in a way that creates real damage. Your relationships suffer, performance drops, self-esteem collapses, and there's a constant overwhelm and guilt that you experience. So the DSM-5, which is the manual basically for diagnosing psychological disorders, characterizes adult ADHD criteria in 9 inattentive symptoms. Okay, so for adult ADHD, a diagnosis only requires 5 of the 9 symptoms, whereas as a child, you require 6 of the 9 symptoms to be diagnosed with ADHD. These symptoms need to have lasted for at least 6 months and have started before the age of 12 and has significantly affected your functioning. So here are the 9 symptoms of ADHD. Number 1, you often make careless mistakes and miss details. You often struggle to sustain attention. You often seem not to listen when spoken to. You often don't follow through. You don't finish tasks. Often you struggle to organize tasks and activities. You often avoid tasks requiring sustained mental effort. You often lose things needed for tasks. You often get distracted, and often you find yourself forgetful in daily activities. Now, here are 5 things you need to know if this video is hitting home for you. There is nothing wrong with your brain. It isn't lazy. It's wired differently. ADHD is strongly linked to differences in brain chemistry, especially dopamine, norepinephrine regulation. So here are 2 examples of what this can look like. Number 1, you can't start tasks until pressure is extreme. Your chase stimulation, phone scrolling, junk food, impulsive spending, constant switching tasks, because your brain is trying to self-regulate. Number 2, ADHD is not always a bad thing. ADHD can be a serious struggle, yes, but it can also become a really powerful advantage when managed properly. Common strengths include creativity, quick problem solving, intense passion, high energy bursts, and thinking outside the box. Here are 3 examples of highly successful people who have spoken out about their ADHD. Michael Phelps, Howie Mandel, Simone Biles. Medication is not your only option. Medication can be highly effective, but it's not the only tool. ADHD treatment works best when it includes medical support. Now, importantly, some medication doesn't actually fix executive function issues. For example, Ritalin doesn't work on most executive functions, but it works very well for focus and productivity. So as you can see, you can take certain medications, but you really need someone to help you with the executive functioning part. Now, that's another video altogether, which we're going to talk about at another point in time. If you find yourself struggling with some of these things, such as emotional regulation, burnout, shame, and overwhelm, there's help out there. Early diagnosis really does make a huge difference here. Sooner you get help, the better. And number 5, if you are going to go on medications, make sure you understand what you're looking for, why you need that medication, and go to a specialist to get it. To see a link on the 3 categories of ADHD medication, follow the link in the description and start your journey here. I'm Byron Werbler from Centered Counselling. Share your ideas. Let's get you back on track.